Hi guys, my name is Jane Woodward and today we're going to talk about the social aspect of sexual well-being. There are going to be 5 different social determinants of sexual well-being that we're going to talk about today, including law and policy, economics, health systems, education, and society and culture. So first off, we're going to talk about law and policy. Legal mechanisms are crucial for protecting human rights and the promotion and protection of sexual health information and services. Laws can actually help prevent discrimination related to sexuality and lifestyle. Government has the ability to enact laws to protect people in the LGBTQA community. An example of a law enacted to protect sexual rights and well-being is called Title IX. Title IX bans discrimination based on sex and protects students at schools that receive federal funds. Not only does Title IX include discrimination for being a girl or boy, but also includes sexual harassment and discrimination for failing to conform to gender stereotypes. Next, we're going to talk about economics. So, a correlation between economic status and sexual and reproductive health is widely acknowledged. Poverty results in high-risk lifestyles and behavior and poor sexual health, while financial stability promotes safer sex practices, leading to higher levels of sexual health. Poverty is correlated with poor reproductive health indicators, including maternal survival, early childbearing, unintended pregnancy, unsafe abortion, and child mortality. Next, education. Sex education is high quality teaching and learning about a broad variety of topics related to sex and sexuality, exploring values and beliefs about those topics, and gaining the skills that are needed to navigate relationships and manage one's own sexual health. Educational policies provide accurate and appropriate sexual health information and counseling that goes a long way in reducing stigma and discrimination. The third thing we're going to talk about is society and culture. So different societies have different groups that would be considered to have the least power and communal support within society, called subgroups. Social seclusion of these subgroups has a major impact on sexual health. Cultural and societal empowerment of these subgroups will improve their sexual health. And globally, homosexually active men and male to female transgender individuals are at a heightened risk of HIV and are socially marginalized in ways that continue to contribute to their vulnerability to infection. Last thing, we're going to talk about health systems. So healthcare provider attitudes and practices affect the utilization of healthcare. Accessible, affordable, acceptable, and good quality sexual health services for all is crucial in order to maintain and protect sexual well-being. Confidential and non-discriminatory health services with preventative, curative, counseling, and referral services should be available to all. And lastly, health systems need to be community-driven and community-based in order to successfully serve their communities. So today, we talked about the 5 social determinants of sexual well-being, including health systems, society and culture, education, economics, and law and policy. Thank you so much.
I will be talking about the physical aspect of sexual health. Sexual health is the physical, mental, and social well-being of a person. It can involve STDs and STIs. Close to the same thing, they are sexually transmitted diseases and or infections. They can be transmitted through infected body fluids, skin and or mucus. This can be skin contact, exchange of body fluids, and or mucus. Prevention and treatments of these consist of different vaccinations that can help or cure some of the infections. Condoms, these are not always 100% useful. Washing and before and after. This means cleaning your areas before and after having sexual intercourse. Testing, you can get tested every month or so to make sure that you are clean and that your partner is also clean, that you guys both do not have any infections or diseases. Number of partners. It is known that if somebody sleeps with somebody who has it, they can give it to you, or if they sleep with somebody or you sleep with someone, you kind of sleep with everyone that they have slept with, because they are all exchanging body fluids and skin contact. The only way to make sure you are 100% safe of any of these diseases and infections is no sex at all, or abstinence. This is meaning no sexual intercourse or oral, anal, any of that sex. This is 100% safe. It'll prevent them 100%. Consent is also one of the physical aspects of sexual health. Consent is a permission to do something or an agreement on both people to do something. So this keeps you from doing something you may regret or something you do not want to do. And that is it for physical aspects.
Talk about the sexual health of a person. They often don't realize the mental part of sexual health, which is the mental and social well-being in relationship to sexuality. Some of the topics that we'll be discussing are the intimacy disorders, abuse, emotions, and help for mental sexual health. First, intimacy. There is intimacy in sexual health. We're going to talk about healthy versus non-healthy relationships. Healthy meaning each partner in the relationship trusts each other, has a good connection with each other, whereas non-healthy relationships is a total opposite, meaning they don't trust each other and they do not have a good connection. Next, for disorders, there are many disorders that can happen to that person and a mental sexual health. For example, the main one is depression. Some symptoms that show through depression is poor diets, anxiety, and isolation with society. Next, abuse. So abuse unfortunately does happen in mental sexual relationships, and abuse can happen to the male or female in the relationship, and also it often refers to mental disorders in the abuse, like we said before, depression. And during that time, they can also feel emotions, feelings that occur during that time. Some emotions that they can feel is anxiety or depression, like we said, and we already discussed the symptoms that show through that. And lastly, because anxiety and depression is a really big topic and something that they should help with, people can get guidance and professional help with mental sexual health. They can get a person that they trust and talk to them about what they're doing or what they're feeling, or they can do sex therapy, which is a term for mental health problems, by talking to a person talking to a mental health professional, and they can seek this kind of help through a physician, a social worker, or a licensed therapist. Thank you.
So I'm going to be talking about the
neuroscience side of sexual health, which is basically your brain and how it fires when it comes to physical, social, and mental health of sexual relationships. So that's things like male and female anatomy and sexual dimorphism, which is
the term used for the physical differences between men and women, such as how men typically are the physically stronger sex, while women, however,
can actually withstand higher pain thresholds. And a lot of these differences actually play a part in mating and how you choose your mate, such as
how females typically are shown to be attracted to men with lower pitched voices and other things like that.
So another part of the neuroscience of sexual health is testosterone and estrogen. So testosterone is the male sex hormone that affects male appearance, sexual development, sperm production, and their sex drive. Whereas estrogen is the female sex hormone that's responsible for the female
reproductive system, as well as secondary sex characteristics, the development
and the regulation of all of that, which is basically a female's ability to have and nurture a child. So both of these subjects have to do with mate selection and how you choose your mate.
So the science behind mate selection
Shows that
you are actually more attracted
to people
to
who have similar
height, similar body weight, a similar IQ, and in
some cases even the same
psychological disorders. So all of this has
to do with basically your brain.
he's a person that you're attracted to, and it's a lot more than
Just like, oh, I think this person would be a good partner for me, but your brain, the underlying side of it is basically that it looks at different things, such as for men, it's typically women who are curvier because
it's been proven that women who have bigger hips
actually are better
and carrying children. So it's things like that that play a big part